Hi guys, welcome back. Today I'm going to be talking to you about acne scars, how they're caused, how they can be treated, the types of scars that you can get, and what you can actually expect from your treatment. So firstly, what types of acne scars are there? You can have Icepick scars, boxcar scars, rolling scars, or hypertrophic scars. Sometimes these are referred to as keloids if they exceed the border of the original wound, or in this case, the acne lesion. It's important to note that hyperpigmentation, which are simply the red marks on the skin following acne clearance that aren't pitted or raised, are not scars but simply the change in the pigmentation of the skin following the local inflammation of the acne lesion itself. How do we know what type of scarring we actually have? Well, let's run through the differences in each of these scars. Icepick scars, as the name suggests, are small pits in the skin that almost look as if the skin has actually been punctured by an ice pick. They're quite narrow and can be deep or shallow. Boxcar scars have more vertical and sharp edges in their structure. They will be often wider, but not necessarily deeper. Rolling scars often make the skin look as if it has a waved appearance to it. They are usually wide and also shallow. Hypertrophic or keloid scars are quite dissimilar to the aforementioned scars in that they are raised, they are not pitted or have deep pockets. These will more than often be on the chest, the shoulders or the back, as opposed to the face. And these are ones that I've actually suffered from on my chest in the past, albeit I have had quite a lot of success in terms of treatment of these scars. They've shown a massive improvement overall. So why do some of us scar? Having acne does not necessarily mean that you will scar from these lesions, as it very much depends on a number of factors, such as your genetics or your inflammatory response to acne. Individuals that exhibit a stronger secondary inflammatory response to acne will suffer from more scarring, as opposed to those who just experience a single inflammatory response to acne. Now, before I dive into what I believe are the best treatments for acne scars, I would like to highlight two very important factors. The first being, I would not expect miracles from these treatments, as unfortunately treating scars is a lot more difficult than treating acne itself. You often show a significant improvement, fortunately, if the correct treatments are used, but you probably won't get back to the skin you originally once had. The second factor to focus on is actually preventing the acne from forming in the first place, which is just so fundamentally important. And this is one of the main reasons I started this channel and this business, to give free advice and to provide treatment products that are more focused on clearing the skin than just simply making profit out of people's suffering. But you may be here because you've already cleared up your skin, and well done you if you have, and you're just simply looking now to clear up your acne scars. But I will start by saying that I wouldn't recommend many off-the-shelf products or products that are sold online for acne scars, as these simply probably won't be strong enough, and anything that is strong enough will probably need to be prescribed by a dermatologist. There are a few exceptions, such as silicone gel, which can be used for hypertrophic scars, albeit I would only recommend using this for early kind of scars, any scars that have come on recently. But most of them will just waste your money. So now, if you follow me, you'll probably know that I am a strong advocate for natural treatments for acne, as I do believe that these natural extracts are strong enough and are very, very effective for treating acne with minimal side effects, albeit in terms of the context of acne scars, I do not believe that these will probably be strong enough or effective enough to actually treat a lot of these scars, whether they are hypertrophic or atrophic. So you will very likely need to visit a dermatologist to get the most suitable treatment, and it's very important that you choose one that you have full faith in and has a high reputation. As you may know already, you can do this by looking at reviews online or asking them for solid testimonials of patients that have had a similar type of scarring to you and that they have treated in the past. So let's go through a list of treatments that have been shown to be the most effective for each type of scarring. It's important to note that a group of researchers in 2018 did a systematic review of a number of studies of different treatments for scarring, 89 different studies to be exact, and they concluded that lasers in general are the best treatment for acne scars. The best treatment for Icepick scars has been shown to be punch excision or cross treatment. The best treatment for boxcar scars will depend upon the depth of the scars themselves. For shallow scars, the recommended treatments will often be lasers, punch elevation, cross, skin needling, or fractional radiofrequency. For deeper scars, it could be lasers, punch elevation, or punch excision. For rolling scars, treatment could include augmentation, SUBCISION, skin needling, or fractional radiofrequency. For hypertrophic or keloid scars, it will often be recommended that you have steroid injections and possibly laser treatment depending on how those steroid injections go. In the worst case scenario, surgical treatment will be recommended, albeit this will only be the case for very large keloid scars or scars that haven't responded to any other form of treatment. And these will often be followed up with the steroid injections or laser treatment to reduce the risk of these scars coming back. Now let's quickly run through what these treatments actually involve. The first one, laser therapy, uses pulses of light that can target the blood vessels in the scar, in the tissue, to actually reduce the redness of the scar itself. Augmentation involves the use of dermal fillers to essentially raise the atrophic scars. SUBCISION uses a hypodermic needle to insert into the scars to essentially break down these fibrotic strands. By doing this, the hope is that you will release more collagen and essentially improve the appearance of this scar. Punch elevation uses a punch tool instead of a scalpel, which should more accurately remove small quantities of scar tissue to elevate the bottom of the scar to remove its depth. Punch excision involves the use of a surgical tool that is sized according to the actual size of the scar to surgically remove it, and then the wound following that surgery is stitched together in the hope of improving the appearance of that scar. Cross uses an acid called TCA, which is often used in high concentrations around 70 to 100%, but in small amounts as you only really want this acid on the scar itself. It works by causing a local inflammatory response on the skin, which forms new collagen fibers and thus improving the scar's appearance. It's often not very suitable to be used alone and will often be combined with other treatments. Skin needling, as the name suggests, involves a roller with small needles. These small needles are usually around 0.5 millimeters in length, and they cause micro punches in the skin, which initiates an inflammatory response, again causing more collagen production, more elastin production, and thus improving the appearance of the skin overall, and in particular the appearance of this scar. We also have fractional radiofrequency, which can be similar to skin needling, as it sometimes involves using microneedles to deliver thermal energy to the dermis. This again can result in more collagen production in only the scar tissue areas. In terms of skin needling, it's actually considered a safer alternative to some of the treatments I've mentioned earlier in this video. And lastly, we have corticosteroid injections, which can break the bonds in the collagen fibers within this scar tissue, reducing the amount of scar tissue beneath. And they're also very anti-inflammatory, which can reduce the redness of the scar tissue overall. So I hope that's given you some good information, guys, in terms of the acne scars that you can experience and the best treatments for those, and my own experience with these scars as well. Please also remember that although treating your acne scars may improve your self-confidence, and it's quite likely to do so, it's important that we focus on our mental health overall, as how we feel about our appearance is only one factor in terms of how we feel about ourselves. So I'd encourage you to look at all the aspects in your life, as having clear skin will likely take off a large burden off your shoulders, but may not sort all of your problems. So thank you for watching this video, guys. I hope it's given you some really good information. I know it was very in-depth and it was a very long video, and hopefully you're still watching it now. But what I'd recommend is obviously go to a dermatologist, because they will be able to give you the best advice in terms of treating your acne scars for your specific case. And as always, I would hugely appreciate it if you could share this video, like and subscribe, as it will help me get this message out, and you'll indirectly be helping other people who will get to see this content as well. Thank you, guys.